Sweating is a natural bodily response to heat and stress, controlled involuntarily by the hypothalamus, a part of the brain responsible for maintaining the body's equilibrium. When exposed to heat or stress, the hypothalamus signals sweat glands to produce sweat, which cools the body by evaporating. Primary axillary hyperhidrosis is a chronic condition characterized by excessive underarm sweating, beyond that required to regulate body temperature. It occurs due to faulty nerve signals that trigger eccrine sweat glands to overproduce sweat. Millions worldwide suffer from hyperhidrosis, a condition that can be isolating and emotionally taxing. Severe primary axillary hyperhidrosis can have significant physical, psychological, and emotional effects. Sufferers may experience social embarrassment, need of frequent clothing changes, limitations in clothing choices, and increased time and energy spent on personal hygiene. In extreme cases, skin breakdown and infections can occur. Various treatment options are available, depending on the condition's severity. These include clinical-strength antiperspirants, oral medications like glycopyrronium or oxybutynin, injectable botulinum toxin, and surgical removal of sweat glands from the underarms. Most recently, the U.S. Food and Drug Administration approved Sofpironium gel under the brand name Sofpira for the topical treatment of primary axillary hyperhidrosis in adults and children aged 9 years and older. However, Sofpironium gel has been available in Japan since 2020 under the brand name Ecloc. This is a schematic diagram of sweat glands in the skin. M3 muscarinic receptors are expressed on eccrine sweat glands. Acetylcholine activates these M3 receptors, resulting in sweat release. Sofpironium is applied to the underarms as a gel formulation. It is a competitive inhibitor that selectively binds to the M3 muscarinic receptors found on eccrine sweat glands. By blocking these receptors, Sofpironium indirectly reduces the rate of sweating in patients with axillary hyperhidrosis. Sofpironium is a soft anticholinergic, meaning it is designed to minimize systemic side effects while maximizing local efficacy. This is achieved through retrometabolic drug design, where the molecule contains a part that is quickly broken down by the body after doing its job. This rapid breakdown helps to limit the risk of systemic anticholinergic effects. Sofpironium topical gel received FDA approval based on data from 2 pivotal phase 3 clinical trials, Cardigan 1 and Cardigan 2. These studies evaluated the efficacy and safety of Sofpironium in 701 patients, aged 10 and older, with primary axillary hyperhidrosis. Patients were randomly assigned to receive Sofpironium or a placebo, applied once daily at bedtime for 6 weeks. Let's take a look at findings from the Cardigan trials. The Hyperhidrosis Disease Severity Measure, axillary, or HDSMAX, is a standardized tool used to assess the severity of excessive sweating in the underarms. A higher score indicates greater severity of hyperhidrosis. At baseline, patients in both Sofpironium and placebo groups had similar levels of hyperhidrosis in both Cardigan trials. In Cardigan 1, 49% of Sofpironium patients experienced a significant improvement in their condition after treatment, compared to 29% of placebo patients. Sofpironium also led to a greater reduction in sweat production than the placebo, as measured by the change from baseline. In Cardigan 2, 64% of Sofpironium patients achieved a significant improvement compared to just 48% of placebo patients. Both groups had comparable levels of hyperhidrosis at the start. Similar to Cardigan 1, Sofpironium again demonstrated a greater reduction in sweat production. There were no treatment-related serious adverse events in any of the studies. The most common adverse reactions reported with Sofpironium included dry mouth, blurred vision, pupil dilation, urinary retention, as well as irritations at application site. These events were transient and mild to moderate. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.